Alhamdulillah, Alhamdulillah, wassalatu wassalamu ala Rasulullah, amma ba'd. Jazakallah khair for everybody joining us this evening, mashallah, on this really important webinar on behalf of the Al-Noor Foundation. Alhamdulillah, my name is Arshad, and I work as a careers advisor for the Al-Noor Foundation. In fact, I've made it, alhamdulillah, my kind of life career to help you in your career. And that's really the purpose today, inshallah. We've got kind of like a host of webinars. So I would just advise yourselves and your families, please keep in touch for the others that are to come. And indeed, today is a really important one as well, regarding the healthcare sector, inshallah. Can I please request everybody to keep their mics off? And also, if there are any questions, you're most welcome to ask any questions. We'll do so at the end, inshallah. And I'll try to get through those as we go along at the end, inshallah. I'll just start on the presentation now, inshallah. So as I've mentioned, alhamdulillah, we are looking at the healthcare sector today, and it's a huge, huge area, the healthcare sector. And we're going to try to get an overview today, inshallah, of what the healthcare sector is about, inshallah. We've got other people joining us as we go along, so alhamdulillah, I'm sure they'll be able to catch up as well, inshallah, as we go along, alhamdulillah. So the healthcare sector, alhamdulillah, it's a very, very big sector, especially that of the NHS. And today what we're going to do is just, as I mentioned, an overview, alhamdulillah, of what the sector is about, and just go through some of the main kind of occupations that are kind of available and the routes to get into them. And if I can remind everybody, if you need to, arrange a one-to-one session, alhamdulillah, I'm more than happy to do that, and we can do that at a later time. I know that everybody's got my email address as well, so you are most welcome, alhamdulillah, just to email me, and then we can have a one-to-one session as well, inshallah, if you have any specific questions. So the healthcare sector, I mean, as I mentioned, there's a variety of roles, alhamdulillah, within the healthcare sector. But what binds kind of this particular care sector together is the ethos, and that is making a difference to people's lives. So, alhamdulillah, if you're interested in this, you really need to kind of be, mashallah, really caring person, somebody who wants to really give to the community and have in return a really kind of fulfilling kind of career, inshallah. One of the myths about this sector is that people kind of feel that you need to have a degree only to get into the sector, which is not true at all. There are many, many opportunities to get into the healthcare sector, and it is not just via the degrees, but you can do so with even very little qualifications or with no qualifications also. So alhamdulillah, we keep that in mind, and I am going to talk more about that as we go along. And the other important thing that we are going to look at and discuss within the next 15-20 minutes today is a variety of ways, rather, to get into the sector as well, alhamdulillah. And there are a lot of ways, that you can do that, and we're going to be looking at that and discuss that as well today, inshallah. So a bit about the background, and the context, inshallah. The NHS healthcare is delivered by many, many organizations, in fact, hundreds and hundreds of organizations throughout the UK. And each organization in itself is an employer in its own right. So if, for example, and that employer may be responsible, as I've mentioned, for vacancies, for work experience, for school college liaison activities, and for apprenticeships as well. One other very important thing to bear in mind is that if you have one NHS sector within your vicinity where you live. They may be providing various apprenticeships and work experiences in that particular NHS. And say another NHS 5 or 10 miles down the road from you may actually not have those experience or not have those vacancies. So please bear in mind that because this is a huge, huge area, the NHS as a healthcare sector, they all have their individual kind of vacancies or work experience listings or apprenticeship programs. So if you're interested in any one of these that we are going to talk about today, it's really important to liaise with all the details kind of I'm going to send you. And alhamdulillah, see what is available within your vicinity and see what works for you, inshallah. Just to now look at some of the opportunities or categories, if you like. And I've listed here a number of categories for us to look at. And these categories, there is no perfect kind of category, if you like, because the sector is so wide. But I thought these were the main kind of areas that I wanted to look at and help you, inshallah. And we could do that together now. So if you look at the allied kind of health professionals, this is kind of like the area where, patients who've had surgery learn how to live with kind of long-term conditions, and that's under the allied health professionals. So they are specialists who treat and rehabilitate, like the art of therapy and physiotherapists, etc. Within that allied health professionals, you have got the physiotherapists, you've got the speech and language therapists, you've got radiographers, for instance, and pediatrics as well. So they all fit in within the allied health professionals. Underneath that, we've listed kind of like the ambulance sector. Within the ambulance sector is actually, I've mentioned, is more than the flashing blue lights, because you've got people like the call handlers who work within the ambulance sector, emergency care assistants, and patient transport services. They all fit in within that particular sector, which is the ambulance services team. Then underneath that, you've got the dental team looking after the oral health and wider health of patients. So within the dental team, you've got dental nurses, you've got hygienists, you've got technicians. And obviously they've got all of their roots in how to get into those particular areas. And needless to say, you've got the doctors. Obviously, the route into medicine is one particular route, but the specialisms within that, as I've mentioned, are over 60 plus. So there are a huge amount of specialisms, if you become a doctor. Underneath that, which is a huge, huge area for the NHS and the healthcare sector, is the estates and facilities. And this is a really, really growing sector as well all of the time. And one of the fascinating things when I looked into this sector is that people are coming to kind of retiring age, and there's a lot of need for many people, subhanAllah, to join the estates and facilities. And under estates and facilities, we are looking at maintaining buildings. We are looking at, for example, people who are proficient in plumbing, for example, people who are electrical and mechanical engineers, for example. The catering staff fall under this as well, the estates and facilities, and also moving goods around. So these are huge, huge kind of areas of work, all fall under the estates and facilities within the NHS healthcare sector. After that, we've got, I've mentioned here, the health informatics. The NHS and the healthcare sectors cannot move an inch, subhanAllah, without data. All of the data kind of jobs and vacancies are within the health informatics. So you've got, for example, analyzing data, handling data, data analysts, reporting data, all of these kind of areas. And this is a huge area which is growing and will grow in the next 10 to 15 years as well on a huge scale. Underneath that, we've got the healthcare sciences, so experts in technology and science to prevent disease and treat disease. So within that, you've got the laboratory works, for example. So if you're interested in working in laboratories, it's really the healthcare sciences that you should be thinking about and the type of courses you need to get into that. Also, you have within the healthcare science is the life sciences, things like biomedical science, which is a huge area. I know of many students who are really interested in this kind of area, and alhamdulillah will actually, apply for a degree, for example, in biomedical science. Then we've got management on this side. Alhamdulillah, with the management, this is about managing people, managing money, managing buildings, general management, things like project management. So if you feel, alhamdulillah, you really want to go into management into the NHS or the healthcare sector, there's great opportunities for you to do that. Underneath that, we've got the medical associate professionals. So this is a small group of people supporting doctors and nurses to release their time and kind of be more involved in complex cases. And people within that are physician associates. So under the medical associate professionals, you've got physician associates who help doctors and physicians. Then another huge area is the midwifery. So supporting women, alhamdulillah, in communities and in hospitals during and after childbirth. Within the midwiferys, you've got obviously midwives, you've got support workers as well, and various ways and occupations, alhamdulillah, to go into there. One of the biggest an area that certainly in the last year, I've been talking quite a bit to, alhamdulillah, our clients as part of the Al-Noor guidance team is nursing. And there are 4 kind of specialisms in nursing, whoever's interested in this, and that's adult nursing, children nursing, learning disability nursing, and mental health nursing. So within these 4 categories, alhamdulillah, you may choose one from the beginning and then specialize into that and become a registered nurse. We've then got the pharmacy, which is another very big area, dispensing of medicines to staff and for patients also. And within that pharmacy sector, you've got pharmacy technicians as well and pharmacy assistants. So if you're thinking about that area and you wanted to go in from the beginning as well, you may want to do courses related to pharmacy assistants, for example. Another very, very big area, subhanAllah, at the moment is the psychological professions, which is really about tackling mental health problems and promoting welfare. As I mentioned, it's a huge growing area. You do need to have professional qualifications, but there are some instances where the NHS and the healthcare sector look at your life experiences and accreditation or prior experiential learning, what you've maybe done in other occupations, and you may be able to enter this sector, but normally you require a master's or even a doctorate for this area. And we're keeping a close eye on this area as well as far as the Al-Noor Career Service is concerned, because I will be looking at this and hopefully we'll invite people to talk, professional people to talk more about this area of psychological professions as well, inshallah. Underneath that, you've got the public health. So it's protecting people from threats. And no doubt, we've had a big public health scare with the COVID-19 in the last couple of years. And so if you're interested in health and helping people stay healthy, then it is the public health you want to go into that prevents kind of diseases. And alhamdulillah, there's quite a lot of research that's been done in this area at the moment as well. Last but not least, you've got the wider healthcare team. And the wider healthcare team really services that keep the NHS running 24 hours a day. So you've got people like the porters, you've got the chaplaincy, the imams, for example, who work in the healthcare, providing guidance, to families, etc., to patients. And they come under the wider healthcare team. So as I've said, alhamdulillah, it's quite difficult to categorize and make a perfect categorization. But I would say these are the kind of main areas of categories within the healthcare sector and specifically NHS, inshallah. Moving on, getting in. and the different kind of entry points. If we can look at the work, and these are various things I've noted here for your convenience on different ways of actually getting into this profession. And there are many, many people, subhanAllah, who've got in the healthcare sector through work experience. So if you feel that you need to have or gain some work experience, it's an excellent opportunity to apply to the healthcare sector and say, look, I'm a college student, doing maybe the GNVQ in health and social care, and I really want some experience. Try to get a foot in the door through that means. And that experience will be very, very valuable, even if it means it's a short period of time. But again, it's something fantastic to put on your CV to say that, look, I've shown my commitment and I've, alhamdulillah, spent a little bit of time and effort to gain the work experience within my NHS. Underneath that, you've got the voluntary. Now, great to offer voluntary experience as well. If you're a student, for example, and every Wednesday, you have 2 hours free or whatever, why not, get into the profession? Why not offer your time to volunteer a couple of hours for the NHS, in the healthcare sector? By doing so, it can open up many, many doors. And I know people, subhanAllah, who have long-term careers. And if you ask them, they said, well, we came in through work experience or we offered voluntary help. And through that, we got to know the people. We got to do some basic training, the fundamental training. We started off from the bottom and then we worked our way up. So it's an excellent opportunity to do that as well. Then we've got the entry level roles. The entry kind of level roles, it's really for people who may even just have a GCSE English or math, for example. By having a GCSE level English and math, you can even get into, things like healthcare assistant, for example, a job related to healthcare assistant, and work your way up from there, whatever you may want to do. And it's a great opportunity. Even at entry level roles, may I add, that there are people who may not have the GCSE English and math and no other qualification, maybe just some life experience. They go through the entry level roles, and then the NHS and the healthcare sector provides them the opportunity to do the GCSE level English and math. So that's a great opportunity, with very, very little qualifications. You can still get into the healthcare sector and work your way up and gain the qualifications whilst you're there. So I would say don't let anybody put you off. There's always, always opportunity, alhamdulillah, to get into this sector. Now, the apprenticeships or training is a massive, massive area at the moment. And we're going to talk a little bit more about this later. But as you know, the apprenticeships comes at various levels. You can even do a GCSE level apprenticeship up to a post-graduation level apprenticeship, so a master's level. So it depends, alhamdulillah, what subject it is you want to do, how much time you want to spend, and apply for this and work your way up through the apprenticeship and training kind of route, inshallah. Again, one of the important things I mentioned a little while ago is that if you have one particular apprenticeship that's been offered in your local NHS, it may not be the same with another NHS down the road, 5 or 10 miles down the road, because every single healthcare sector and the NHS is offering their own program according to their own need. So please bear that in mind. If you see a vacancy, in other words, it's going to be specifically for that particular NHS that's offered the vacancy. And that's the great time to apply. Then we've got, after a course at FE College. So in FE College, one of the most prominent courses is the GNVQ Health and Social Care. For example, the health and social care can lead on to all sorts of degrees that you may want to do after that. And then you've got, after approved higher education course, a diploma in HE. There are great opportunities if you're doing a H&D, a H&C related to healthcare. Alhamdulillah, that can also get you working in the NHS. Then we've got the degree here on our right on the top. And especially, as you know, for nursing, for dentistry, for medicine, you do need a first degree. Alhamdulillah, it's usually a 5-year program for you to do that. And that gives you an excellent opportunity to work as a doctor, for example, or be in medicine or in dentistry, etc. Now, one other important thing I need to mention on the degree aspect is that if you are, for example, a student, who's completed a degree in any other subject, say you've got a degree in law, or you've done a degree, your first degree in biology, and you really want to work for the NHS, you've got still excellent opportunities to do that, because what the NHS and the care sector kind of provide is what's called accelerated learning. So what they do is they look at your degree, and this could be a degree in history, as I mentioned, or any other subject. They look at your degree, then they advise you to say, well, if you go on to the accelerated program, which could be a 2-year program, we can then get you to become a nurse, for example, and get your registration. So it's a great opportunity called accelerated learning program if you have another degree and you want to convert that and you want to work in the healthcare sector. And also, I think it's important for me to mention on the entry level roles, which is kind of like the least kind of roles if you have kind of like GCSE or you don't have GCSE English and math. But if you're a mature student, say somebody who's 25 and they want to really become a nurse, and they have English and math GCSE, for instance, they could go on to do, because they're a mature student, for instance, do an access course in nursing. That's a 1-year course. That access course will then lead them directly into a degree program. So I wanted to give these two kind of extreme examples to show you that you can really join the healthcare sector and the NHS at entry level, or you can join even at a degree level if you have a degree and you're converting that degree. And then after that, you've got the post-graduation training, mainly for courses like clinical psychologists. Clinical psychology, you need to have a postgraduate, which is a master's or a doctorate level qualification at least. So alhamdulillah, there's great opportunities in that. Last and not least, one of the really, really important things to mention is after experience gained outside the NHS. So if you're, switching your careers and you have got life experience, the NHS really, really want to hear from you. And alhamdulillah, that could be in any other field. So you may be a manager, you may be doing surveying, a building surveyor, for example. You may be in management and you want to come into the NHS. They will put you on a program, look at your what is called accreditation of prior experiential learning, what you've done in the past, how old you are, how much experience you have. And then they will put you in a program. It could be a 1-year postgraduate diploma, for example, in management or whatever you want to do, but they will actually value your life experiences. So there is that great opportunity for people who want to switch, as I mentioned, their careers, inshallah. Next, I wanted to share with you just some recent kind of apprenticeship vacancies that have been kind of prevalent in the last kind of 3 months, just to give yourself an idea on the kind of courses and the subjects that are available. So there are mentioned here some clinical and some non-clinical as well. For example, you can see here on the top right, a registered nurse degree apprenticeship. So this is somebody who's got A levels and wants on to become a registered nurse in learning disabilities, for example. That's available in Lancashire. The nursery nurse, for example, is available there. You've got the operating departmental practitioner available as a degree apprenticeship as well. Biomedical support worker apprenticeship, psychological wellbeing practitioner in the Midlands. And you can see here, as another example, financial accountant in Southampton. Now, really important to mention also here that most of these vacancies are available on the NHS jobs website, which is www.jobs.nhs.uk. And I'm going to give you these details at the end, inshallah. But the NHS has a special kind of jobs website, and you'll find these apprenticeships there as well. The government also has a website as well in which they advertise the apprenticeships, and I'll give you the information of that. However, whenever I've kind of checked on the government website, for apprenticeships in the healthcare sector, there's always very, very few. But it's always, always best to check on jobs.nhs.uk. That's where the main kind of vacancies are, for the apprenticeships and for graduates as well. So all types of jobs in the NHS, inshallah. Just to give you an example here of some degree level apprenticeships. So people, who completed their A-levels, 3 A-levels, for instance, and they want to go on to do, the apprenticeship programs and work in the NHS and also qualify at the same time. And it just gives you an idea, alhamdulillah, of the variety here of the degree level apprenticeships that are available. So, you've got kind of dietitians to midwifery. You've got occupational therapists, for example, paramedics, for example. This paramedics on the bottom left is quite interesting because recently I noticed on paramedics, they really would prefer people, and paramedics is the ambulance service, for those that don't know. So if you're interested in working for the ambulance service, they have an excellent kind of in-house program that I was kind of investigating and looking at. And I think the reason being currently, they were offering this program to in-house kind of employees. And if you're not an in-house employee, then you may need to do an emergency care system course to get into the paramedics. And that's a great way of getting in also, alhamdulillah. But otherwise, they were offering in-house kind of training, and it's really, really good training to become an ambulance worker. Occupational therapists, as we mentioned, etc. And on the other side, physiotherapists, for example, public health practitioners, registered nurse, all of these apprenticeships are available. Social worker. I mean, social work is such a huge, huge area at the moment, and they desperately need people, so if you are looking for a degree level apprenticeship and you want to go into social work, it's highly well paid. The job, alhamdulillah, can be stressful, no doubt, but it's really, really rewarding, I would say, and it gives you a professional qualification. Speech and language therapist also is mentioned there as a degree level apprenticeship. One of the websites I've also listed for you at the end of this presentation is the HASO website, which is the Healthcare Apprenticeship Standards Online. That particular website is also used by the NHS to list the latest kind of apprenticeships and standards. And it's really, I would say, a gold mine of information. It's got so many good kind of listings and information there. And I'm going to leave that for yourselves. And if you wanted more information around that, we can talk kind of later and, through email as well. But a lot of apprenticeship information and standards are available on this particular website. Again, it's haso.skillsforhealth.org.uk/standards. And I'm going to leave that for yourselves as well. Next, we've got the full-time undergraduate opportunities. So if you're thinking about going into a degree, you've completed a BTEC or a GNVQ in health and social care, where you've got 3 A-levels, you've done biology, you've done math, for instance, or chemistry, and you're thinking about, going into a degree program. These are the kind of listings you can see before you for, doing a degree, which is an undergraduation. This could range from 3 years up to 5 years, depending on the program that you do. So alhamdulillah, from dental hygiene to dentistry to medicine, midwifery, environmental health, as you can see, healthcare science, audiology, which is to do with the hearing, etc. Nursing, we have occupational therapists helping people in the community, after surgery and things like that, get back to normal life, etc. Pharmacy, paramedic science, etc. Physiotherapy, radiography, speech and language therapy. All of these, many, many universities across the UK do the undergraduation program. alhamdulillah, if you were thinking about, the NHS or the healthcare sector for these, inshallah. One important thing maybe for me to mention here is that if you go on to do medicine and dentistry, which is a 5-year program, at the end of, or rather the 5th year, the NHS also have a learning support fund, and they do actually give some money or give you financial help in the 5th year. And this is really interesting, especially to help with living costs and things like that. And I'm going to talk a little bit more about that as we go along, inshallah. Um, I've got here a graduate opportunities for kind of non-clinical roles. So just to quickly go through these, and these are huge areas at the moment, but the focus and the reason I wanted to share this with yourselves, the focus of this is really what's going to happen in the next 10 to 15 years, where there's a lot of vacancies for digital work and data work. So data technology, and the focus is on digital work. So it's called Graduates into Health. And you can see here, focus on information management, IT, finance, business administration, and it's a rolling intake. So they have 2 or 3 entries in the year for you to apply. So alhamdulillah, great opportunities to do that. And it's all done through Graduates into Health. That's their website. It's called Graduates into Health. These are all non-clinical kind of vacancies. Then you've got the NHS Graduate Surveyor Training Program. And as you can see, this is the Royal Institute for Chartered Surveyors. And you can do a 2-year program. And this is obviously in relation to the NHS property services, etc. And then you've got the Digital Graduate Scheme. So again, it's software development, it's about management, it's a 2-year program, and it's apply via the NHS Digital as well, alhamdulillah. So anybody who's interested in kind of digital, kind of data, kind of computing, software development, the NHS got huge amounts of opportunities there as well, inshallah. Just to quickly go through the financial kind of support, the bursaries for nursery or nursing finished in 2017. And since 2020, the NHS was offering kind of training grants. And so these were not loans. These were kind of grants given, so you don't have to pay back. And these were towards living costs. So as I mentioned here, the training grants of 5,000 per year for eligible students who are studying nursing, midwifery. You can apply for this and you would get this. On top of that 5,000, as part of the Learning Support Fund, if you had, as you can see there, if you were doing a specialized subject area like mental health, nursing, learning disability, you get £1,000 on top of that 5,000. So that's nearly £6,000 a year. If you are a parent and you have children, you get £2,000 also from this particular Business Services Authority, the NHS BSA. So if you're choosing specialized subjects, you are eligible for this grant also. And then they also offer Exceptional Support Fund, which is for students who are kind of facing hardship, financial hardship, and that's up to nearly £3,000 a year as well. Now, all of these grants are available, but the eligibility, and this is the important point, is that you must be receiving student finance. So tuition fees and maintenance, you must be in receipt of that in order to then qualify, for extra financial support on particular courses that you're doing with the NHS, inshallah. Last but not least, just to put some contact details here. And alhamdulillah, we are recording this session. If anybody wants the recording, alhamdulillah, I'm sure we can look at that and you can email me. But the details are here if you wanted to note these down. As I mentioned, most of the jobs, if not all, are under the jobs.nhs.uk. So all types of vacancies. And I mentioned the HASO related to the apprenticeships. You can take their details and it's a wealth of information there. There's a phone line there direct for any help and assistance as well. And, other other means as well that you can actually contact the NHS as well, inshallah. So, alhamdulillah, this was kind of like my overview and presentation. I hope and pray that you found it helpful. If there's any questions, please do put them in the chat, and I can actually look at them now and go through them now with you, inshallah. So we'll just have a look and see if there's any questions. So if you do have any questions, alhamdulillah, please do mention them. If I can answer them, I will. If I can't, I can do some research for you, inshallah, and we can check and find out, inshallah. There's a question here, mashallah, asking about do you have any CV workshops to help improve chances of getting a good job within the NHS? The simple answer is yes. I do various kind of presentations, if you like, or assistance that I give students just to prepare their CV and their supporting letter. So I would say to you, sister, please, if you email me, and then I can look at your CV and then help you decide, because it really depends on the type of job you're looking for. And then, inshallah, we can take it from there. But definitely we help in CV writing, and we help in clients, look for the vacancies as well, inshallah, as part of our career service. The career service, alhamdulillah, is a paid service. So you'll be required to pay, but the results are going to be very, very good, inshallah. And we endeavor to do our best as part of Al-Noor careers to help you. Another question, thank you, Jazakallah khair, for the webinar. I would like to ask, what would be the best entry IT business role to look out for which don't have many prerequisites or experiences needed? So the question is, what would be the best entry IT business role? Alhamdulillah, I would strongly advise you, Junaid, that the opportunities via the apprenticeships for IT, there's great opportunities in that sector at the moment. And it depends, brother, if you what you have at the moment. If you have GCSEs, for example, English and math, we can look at them favorably. If you have any other particular IT qualification, then we will carry that with us into the NHS as accreditation of prior experiential learning. So please do get in touch and we can have a further chat about that. But IT is a very big area, as you've seen through this presentation today, inshallah. Another question, how would one go about applying for nursing or medicine apprenticeships, deadline and entry requirements? Jazakallah khair for the question. Medicine, you need to apply. It has got some exams and tests that you need to do. They have their timings around that. That's really important. You need to have the right levels of A-level, qualification is usually A stars, etc. But I'm really glad you've asked this question, because one of the good news is there's a level 7 apprenticeship in medicine, and it's going to start this year, inshallah, in some NHS hospitals, so university hospitals. And that's excellent news, because it's really there for people who are disadvantaged within the community, or people who cannot afford it, for example, and you've got a great opportunity to apply. So please do get in touch with me and we can investigate this further. But just to reiterate, there's a level 7 medicine program that's going to start this year. It's going to have very few kind of admissions at the beginning, inception stage, I assume. But I think it will open up, and it's really for disadvantaged communities and people. So keep reading this space, inshallah. Any other questions from anybody? I think probably that was the last of the questions. But thank you so much. Suffice for me to say, thank you so much for your participation this evening. I'm really honored being able to, alhamdulillah, speak to yourselves and give you some information around this. Please, as I mentioned, we've got many other webinars coming up on all sorts of subject areas. You may be interested in a subject area. Please do email me and give some recommendations. I'll be more than happy to look at that and get your families, friends kind of involved as well for them to attend. It will be very beneficial. So suffice to say, thank you for all your questions. Jazakallah khair. We will end here now. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك ونتوب إليك. جزاكم الله خير. والسلام عليكم ورحمة الله وبركاته.